my name is Dr. Ramisa Rope. I'm a PGY1 resident at Huntsville Memorial Hospital. Come take a tour with us. Come check out our GME suite. Welcome to our resident lounge. Here you have a place to relax. You see our resident here. You can help yourself to coffee. Drinks are usually stocked in the fridge. You can help yourself there. All right, now let's take a tour of our didactics room. So back here we have our ultrasound table, and this is for OMM practice, and this is our ultrasound. We have our Mindray and our portable unit here. Okay, so you learn to use both, and we have training on this every Friday in didactics, which we'll see behind us here. We have our TV screen, we have our tables and chairs set up, and here you also will have access to the digital version of the AFP magazine. And didactics, we also like to make it fun. And here we have our wall of fame, which are presentations done by our senior residents. And who knows, maybe one day you will be on this wall. Here we have an outpatient rehab facility. You can always refer patients back here for Come check out the RHC, which is the Rural Health Clinic. This is where we see our patients. We have several rooms that will be assigned specifically to residents. You'll have your own MA who's going to help you get through the flow of the day. All right, let's go. Here you go, guys. State of the art, ready to go. Patient table, everything you need right here. Okay, so as you know, primary care means a lot of patient education. We have this tablet here, several topics for you to choose from, and then you can go specifically into different ones, talk to your patient, for example, lung cancer screening. Ready to go. This is our lab. And now let's look at the residence room. And adjacent to our rural health clinic, we have OB.
Hello.
And here we have ortho. Now we're headed to the hospital. All right, welcome to the hospital. Here's the parking lot. Good thing about this is that you don't have to pay for parking.
Hey guys, so here's the doctor's lounge. Over here you have your drinks. They usually keep it fully stocked with energy drinks, teas, all the caffeine you would ever need. And then over here they keep water, milk, juices, and then wraps, some quick things to grab and go if you're ever on call or on the weekends. Over here we have some charting areas where you can come here if you ever need just a quiet area to come and chart. You can come in here, you can eat your food and take care of your notes and close those charts out. And then over here is the hot food that the cafeteria makes and serves. It's usually a different cuisine every single day. Because of the dietary restrictions that a lot of people have, they do cater to a lot of options. They do serve breakfast and lunch. And then over here you can get all the unhealthy snacks or all the crunchy munchies, the chips and donuts.
All right, guys, let's check out another part of the hospital. Now you'll notice here we do have an outdoor patio. There's an entrance on the other side as well, and you can come sit out here, enjoy your lunch, take some time off. Here we have our infusion center. This is for our patients who need different infusions for different therapies. This is our pharmacy over here on the left.
Hello, my name is Brandy. I'm a registered nurse that works here in the Outpatient Infusion Center at the Huntsville Memorial Hospital. Here in the Infusion Center, we do IV hydration, blood transfusion, IV antibiotics, IM injections, and therapeutic phlebotomy.
And here we have our cath lab. So we have STEMIs that we perform here. We have a lot of good work that's done.
So we just finished a heart cath in here. Cardiac cath lab, the most fun you can have in a hospital, bar none. This is the cath lab. This is our C arm. Goes like this, moves all around, puts the patients there when they're having a heart attack, open up their artery, boom, pop your uncle, they're fixed. Or we open legs, or we put in neck tubes, or we do a whole host of other things. But cath lab, most fun. Interventional radiology, remember that. Yeah.
Now we're going to go to L&D.
Hi, I'm Al Petrie. I'm the Perinatal Services Director at Huntsville Memorial Hospital. This is one of our labor rooms. They are all set up essentially the same. Baby warmer here, fetal monitor, labor bed. We have a level 1 maternal designation and a level 1 neonatal designation. We have NMPs either on site or within literally 2 or 3 minutes away at all times. Our nursing staff ranges from about 3 years experience to 30 years experience. They are very adept at in labor and delivery. They're very knowledgeable, they're very helpful, and they're happy to answer any questions that you might have.
Hey guys, come and check out the resident sleep room. So we designated this area right back here because it's very, very private. So I know it looks crazy. They use this area for storage, but we did choose these locations for the sleep room because there's not a lot of traffic in the hallway. We do have a male and female sleep room. Both of them look identical. So in your sleep room, you have a nice twin bed, mini fridge, a nice TV with the HDMI cord. So if you wanted to hook up your laptops and chart on there, you certainly can, and a microwave. Hey guys, now we're on floor 2. Come check it out. So down here, y'all just saw the L&D floor. On this side and the other side is our IMU unit. And now we are over here in the doc box where you guys will be charting here on the inpatient unit.
All right, now let's go to the ICU. This is where we're going to have our intensive care patients, and then we have a 6-bed ICU, 1 negative pressure room, and this is also where we have our CCU ICU patients mixed in with the free world. So let's go check it out. You'll be here in your medical rotation and also second year ICU rotation. So you'll notice guards posted out in front of the rooms. Those are our CCU patients. So now we're on the 3rd floor. We have inpatient rehab over here. And on the corners of the 2nd and 3rd floor is where you find the doc box. This is where we all catch up with our attendings and complete our notes. And this side is our surgical side. Another doc box right here.
Welcome to CCU, the Correctional Care Unit. that houses the inmates for the Texas Department of Criminal Justice. We have multiple inmates that come through here for multiple procedures. On this side we have acute care inmates who are here for short-term care. On the other side over here we have infirmary inmates who are here for more long-term care. They get everything from dialysis to surgeries, any type of procedures, physical therapy, occupational therapy, anything that's provided here by the hospital for the regular patients are provided to these inmates also.
Hello, I'm Bill Malner and I'm the Director of Radiology here at HMH. So in our radiology department we have all the modalities that you might expect us to have. We've got nuclear medicine, CT, MRI, mammography, ultrasound, DEXA, and plain old X-ray. So we have all of those modalities to provide excellent images for our community.
All right, guys, welcome to the front of the hospital here. We're working backwards a bit, but this is going to be the main entrance for patients to come into the hospital. Here's registration, and let's head back towards the cafeteria. We have the cafeteria. So here we have the cafeteria. Breakfast is provided here. As residents, you are covered $15 for both breakfast and lunch separately. They have a lot of great options. They have vegetarian, non-vegetarian. Breakfast usually is eggs, potatoes, gravy, biscuit, sausage, and different kind of meats. Turkey as well. The lunch ladies are amazing. They'll remember you and they just make you feel at home. And then over here, we have our cafeteria vending area. So this is open around the clock. You can come sit in here, bring a group in. They also have a vending machine if you like. Now, all these things are available for within your $15 allotment in the cafeteria. And then you also have things in the lounge. You don't necessarily need to, but if you want to, you can purchase them here.
Okay, so we just came from this other side to the cafeteria. If you come to the opposite side of the hospital, you do have your gift shop right here. I sometimes will go in there and buy candy, or if you need ibuprofen or anything like that, they do have that to purchase in there. Okay, on this side is our elevators to go up to the second and third floor, our inpatient side. And then down here you guys saw the radiology lab, but down the hallway is our 24-hour lab, and then this door right here is our pathology lab. Our pathologist, Dr. Payne, is amazing. Anytime you guys have a pathology case, if you're in the OR and you actually want to see like your specimen, she will allow you to come in and check that out.
Best part of the hospital, vending machines.
Hello, I'm Dr. Khan. I'm one of the ER doctors. This is Dr. Allen. He's one of the first-year residents, and this is our emergency department. So we have a 15-bed main ER, and we have a special unit for the inmates, which is 5 beds with some chairs as well. We're a certified level 4 trauma center. We're a stroke center. We have a cardiac cath lab. We just don't do emergency catheterizations. And the residents all get to rotate here 1 month every year. They all seem to enjoy it. I'll let you do whatever procedure you want that you're comfortable doing. We hope to have you here.
So this is our teledoc. We use it to consult neurology anytime a patient comes in with a stroke or stroke-like symptoms, a co-stroke it's called, and then we're able to dial in or FaceTime in a neurologist to kind of help do the evaluation on the patient. So this is the emergency department area for our patients who are at the TDCJ. And these are some of our treatment rooms for them. So we have 4 rooms and then chairs if needed.
Alrighty, so in the Huntsville area, we do have 7 prisons, all for male offenders. When they come into the hospital, you'll always have multiple guards going in with you, at least 2 to 3 is what I've experienced. They'll always be in the room with you, and then you'll notice that your prisoners are always shackled. So they'll have handcuffs for their hands, and then their feet will be cuffed as well. And now we're in the surgical department. Here we have 5 ORs and 1 GI department. Let's go. Come enjoy your time out here in the courtyard.
And that is all for the tour here at HMH. We hope to see you guys soon. Thank you.